Hello, my name is Amanda Carabello. I am completing skill demonstration 1 for cognitive behavioral therapy, a master's level course at the University of South Florida Social Work, School of Social Work. Okay. Hi, Mr. LeBlanc.
You can call me Marcel.
Okay, Marcel. I wasn't sure how to pronounce your first name. Thank you for letting me know.
Sorry.
All right. Well, it's wonderful to meet you. I'm Amanda. I'm an LCSW here at Hope on the Horizon. I want to commend you on taking this step to improving upon your well-being. There are a few things that I do want to make sure to cover with you before we get started, okay? Okay. First, I want you to know, of course, that this is a safe space. Anything that we talk about here is confidential with a few exceptions. First, of course, if it's decided that you are a threat or a harm to yourself or anybody else, we have to let the right people know. Okay. Does that sound fair?
That's fine.
Okay. Also, if you were to sign what's called an ROI or release of information, that would give us permission to share some of your info with other providers.
Okay. Like what?
Like the things that we discuss here, the progress that you're making. We would share that maybe with a psychiatrist that you're working with, or maybe even your primary care physician, just so that we're all able to work together to provide you with the best care. Does that make sense?
Yeah, it's fine.
Okay. So let me tell you a little bit about no, that's not true. Tell me a little bit about yourself, Marcel. What brings you in today?
Uh, Feeling depressed a lot.
Okay.
I don't go out much. I don't have a lot of friends. Uh, I work a lot. All around loser. But just trying to get help.
Okay. It sounds like a lot. You took the first step in making this appointment and then, meeting with me. I know even sometimes making a phone call seems insurmountable when you're feeling depressed. So I want you to give yourself a little bit of credit there. Okay. Have you ever tried therapy before?
No.
No? Okay. So I want us to work together. Okay. So we will come up with some strategies on how to reframe your thinking. Negative thoughts often lead to negative feelings. And then we might start to notice a change in our behavior. Like you said, you don't really leave the house. Some of the negative self-talk, that you feel like you're a loser. If we tame our thoughts, then we can change our feelings and, just improve upon how we're feeling overall. This is called cognitive behavioral therapy. It's one of the approaches that I find pretty helpful, and it's one that we'll use when we're working together. How does that sound?
Believe and achieve, I guess, right? Sure.
Okay, good. There we go. Working on your mindset already. I like it. During our first session together, I'm really just evaluating. I'll ask you questions to get a better understanding of your situation. This will let me know how best to structure your treatment and make an informed diagnosis. When would you say you started noticing a depressed mood?
Not really a mood, but a year ago,
Okay. So it's just all the time.
comes and goes.
Okay. Um, was there something that happened around that time?
Not really, and I can remember.
Okay. So what are some things maybe that you've tried to get yourself to feel better? How would you say your mood was prior to a year ago when you noticed feeling kind of depressed?
Well, it wasn't kind of like a feeling, it's just kind of feel it all over type of situation. So
Okay, explain that to me. You feel it in your body?
yeah, it may not be like something that happens and you feel depressed. It's just kind of you just work normal stuff, I guess, and
Mhm.
then you feel it come over your body. You feel weak, feel tired. Your stomach starts to turn a little bit for no reason, and then you kind of fall into this little pit, and it's just hard to get out of.
Yeah. Do you notice that after you finish working? Do you notice a pattern to it at all? What's going on when you start to feel those things?
I mean, maybe you feel it beginning a little bit of the day,
Okay.
and progressively it just gets worse, and
Throughout
then it
the
might
day.
get better for a minute, but then it can just get worse all of a sudden,
Mm,
and nothing really happens to you. Like nothing happened in the day; it just happens, and you just kind of feel it coming. You can kind of know that you're gonna have a bad day.
mm. Yeah, so that's one of those thoughts that we want to try to change is feeling depressed or sad, tired, and then automatically thinking, I'm going to have a bad day. That's one of the things that we want to try to change so that, like, what was it that you said? Believe and achieve.
Yeah.
Yeah, that's pretty much what we're trying to do here. Um, so thank you for telling me those things. Um, so you said you don't really have many friends? No, what about family? Do you have family in the area?
Not really.
No? Okay. How long have you been here in the Tampa Bay area?
5 years.
Okay. So your family, you would say, is where you moved from? Was
Yeah,
it far?
yeah, Louisiana.
Louisiana.
Yeah.
Okay. What brought you to Tampa?
Work.
Work. Okay, I gotcha. And now you feel like it's pretty much all you do
Mm-hmm.
here.
Well, that's good as well.
Okay. Um, have you ever felt this way in the past? The depression?
Mm. Stuff gets you sad sometimes. You feel
Sure.
depressed. General, like, but there's a reason behind it.
Right.
Like flat tire. Feel depressed. I'm stuck on the side of the road. That's you know reasonable, but not unreasonable sadness.
For seemingly no reason.
Yeah.
Okay, I gotcha. All right. So now that I have a better understanding of kind of what you've been experiencing, what we'll do is come up with a strategy on how we can, like, tools that we can use to get over this and get moving a little bit. We want to definitely improve upon your well-being, and I want us to do that together. Okay, it's kind of a collaborative process. So there will be um, homework, kind of, no worksheets, no math, anything like that. But I'm going to give you some ideas, and then when we meet again, I just want you to report back and tell me how it's working. You think you can do that? You can try at least. Yeah, I think you can. Yeah. All right. What would you say to, well, first, I guess, before we get too far ahead of ourselves, um, what do you think? You said this is your first time in therapy, right? Okay, so what do you think? Do you have any feedback? What would you like to see more of or less of from me during our time together?
Uh, Talk more about what's going on. And maybe not look at your computer so much when we're talking.
Sure. I apologize. Yeah, just trying to keep us on track. But thank you for letting me know.
Sure.
I will definitely make sure that I'm more prepared so that I can focus more on you. Okay. Good. Thank you for that.
Welcome.
All right. And again, I commend you on coming in. It's a huge first step, just getting over that. Now we've kind of broken the ice and we can meet again. Would you be open to that?
Yeah.
Yeah. Okay. Maybe in a week or so.
I'll see if I can get time.
Sure. Okay. And during that time, I want you to kind of mentally note what you're doing whenever you feel like a big surge of those negative emotions. Okay. That's it for now. Just let me know. I'm sitting on my couch or I'm making breakfast or, whatever it is. Just try to make a note so that way we can tailor our treatment plan so that it's the most effective it can be. Okay?
Mhm.
Cool beans. All right. Sorry to look at my computer again. I just want to make sure we cover all our bases. Um, okay. I have all of your insurance information here. All right. Well, thank you so much for coming in, Marcel, and I'll follow up with you in about a week and we'll see what we can do from there, okay?
Okay.
All right, awesome. I'll see you later. Thank you for your time.